What we're going to cover today is MedlinePlus is the bulk of it. I just wanted to keep it, like, if you've never used Adobe before, if you look across the top, you can see a little gentleman with his hand raised up. So if you have a question, you can just raise your hand right there, and then I'll get a little notice that you've raised your hand. If you agree with anything, if you need to step away, or if I need to speak louder, there's a bunch of little instructions you could give me there. If you have any technical issues, you can message Zach directly. He's our IT guy for today. And if you have any questions, feel free to either raise your hand or pop them in the chat box, but I will stop periodically to see if anybody has any. Okay. And since they've given me control, slide number 1. The National Library of Medicine is the world's largest biomedical library. It maintains and makes available a vast print collection and produces electronic information resources on a wide range of topics, as we'll see today, and it's searched billions of times each year by millions of people. It also supports and conducts research, development, and training in biomedical informatics and the health information technology. What you may not know, or what you're here for today, is that the NLM also produces and makes freely available a variety of K-12 resources for educators. But to be quite honest with you, I actually use them here even at the college level for medical school, because most of our students are going to be out in the field, and occasionally they need to create and use tools from this as well. So in addition, the NLM coordinates a 6,000-member national network of libraries of medicine that promotes and provides access to health information in communities across the United States. And this little number 1 here is us. The mission of the National Network Libraries of Medicine is to advance the progress of medicine and improve the public health by providing all U.S. health professionals with equal access to biomedical information and improving the public's access to information to enable them to make informed decisions about their health. And I do apologize, I have a cold. I just started yesterday, and so I'm a little nasally. So this program is coordinated by the National Library of Medicine and carried out through a nationwide network of health science libraries and information centers. The NNLM, as we like to refer to it, because we're librarians and we're all about acronyms, has been serving the biomedical information needs of the nation for over 40 years. It was established by the Medical Library Assistance Act of 1965. Member libraries and information centers in the NNLM provide health professionals and the general public with health information resources and services. Members are supported via 8 regional offices under contract to the National Library of Medicine, and there you'll see your 8 regional offices. I would encourage all of you to contact your regional medical library and see what resources and services are available to you as educators. Membership is free, and the RML, the Regional Medical Library, provides trainings in person and online and a variety of other services. And just to give you an idea, I hopped on the Mid-Atlantic region page today, which is ours. And just some of the upcoming classes going on are drug courts, a bridge to recovery, transgender health research and resources, health aging, connecting older adults to health information, and owning your health wellness resources for young adults from 18 to 24. They have recordings of previous ones if you missed them. There's a lot of programming ideas and guides, and of course information about funding for anything that you have an idea about as well. So today's agenda, hopefully, barring our winter storm, is to review MedlinePlus, that's the bulk of it, to look at some of the other research databases that the NLM offers, and then some additional materials. We'll look at some health promotion, where you can find health statistics, some evidence-based practice, and then the teach back method. We are going to do some exercises today. They actually built those in, and so if you're tech savvy, if you would have another window open and actually go to MedlinePlus, that way you can kind of see as I do, because my screenshots are going to be a little dated anyway, regardless of how quickly I add new ones in. They're constantly updating this stuff literally daily. So MedlinePlus, and yes, I'm going to say the dreaded Google word, so if you just Google MedlinePlus, you'll find it. There is an enormous amount of health information available online, as we all know. We've all done it. But as we go through today's session, I want to address one particular question that I often get as a health librarian, is why use MedlinePlus instead of, Googling it or Yahoo from back in the day. And my main answer is that MedlinePlus is vetted. These are professionals. These are really smart people who know what they're doing, and they're vetting this stuff. And so if you Google something, you might get it on the first hit, but then you might not. And so this is a really a safe place to go do a search for a resource and get hopefully exactly what you need. Okay, so we are going to look at MedlinePlus first. That's the bulk of today. And again, I'm looking at it on my other screen, and already the pictures have changed. So you're going to see something a little bit different. However, the basics are about the same. What you should see at the top left is health topics, drugs and supplements, and then videos and tools. Over on the right-hand side, there you have a little section about MedlinePlus. There's a site map, FAQs, and a contact us. If you do find something wrong, like if a page isn't working or if information is incorrect, they're actually really good about responding to you probably within 24 to 48 hours, depending on the time of day and the day of the week that you're posting your question to them. It's a little bit more streamlined than it used to be, but still provides access to the three main areas. You'll also find more prominent links to the medical encyclopedia, which you'll see down there. And then if you're actually on the screen, they now have also lab test information. MedlinePlus adheres to strict quality guidelines. It's updated daily and is available in English and Spanish. And as you can see in the upper right-hand corner underneath the search box, it says Español. So we're going to take a look at each of the major sections as we go through today's session. Not all of the content is going to be appropriate, as there are links to information on sexual and reproductive health, but you can direct students to those which are, and then provide direct links to resources that MedlinePlus links to from other reliable agencies. So we're going to look at, you can see on the left-hand corner, you've got health topics, drugs and supplements, video tools. In the middle, there's a today's health news. However, I'm looking now at my other screen, and now they actually have tweets in the middle there. So, and this I just updated this webpage or this PowerPoint as well. So yes, MedlinePlus actually has a tweet. You can sign up for their newsletter. You can also sign up for email updates. You can subscribe to their RSS feed and follow them on Facebook as well. So we all know, working as librarians and just the regular people use different search strategies in order to browse different websites. For that reason, MedlinePlus is designed to accommodate different user preferences. So you're going to see, you can type a keyword in the search box, which is up in the upper right-hand corner next to the word go. You can scan a list of topics. You can click on the meaningful icons, as they refer to them, or virtually appealing images, or simply browse the pages. And basically what they're saying is no matter how you search, you should be able to find what you're looking for here, depending on your search preferences. So we're going to look at health topics first. Okay, so that's in the upper left-hand corner. So if you've got your other browser open, you can click on health topics. And I'm going to do the same. So basically this is a lovely little A to Z collection. And then they also break it down by subject area. And these are going to link to selected government agencies and health-related organizations, and they will tell you which ones you're connecting to. They may include some interactive tutorials, videos, easy-to-read materials, as well as NIH publications. They appear on MedlinePlus Health Topics pages, but they're listed individually in the search results as well. You can browse by body, location, system, disorders and condition, diagnosis and therapy, demographic groups, or health and wellness. Back on the home page, or even at the top of the page you're at here, if you know what topic you're interested in, you can bypass all the health topic pages and just use the search box as well. So we're going to try asthma. So for those of you who have your other window open, it's okay to look away. I don't know. So you can either type in asthma in the search, or you can go under health topics and click on A and try to find asthma. And so once you've searched for asthma, you should be brought to a screen that looks a little bit like this one. Oh, maybe not. This one. If you just did a search for asthma in the top, that's what it's going to look like. You'll notice it also lets you refine over here on the left, and I know you can't see my mouse moving, but I'm focusing on the left-hand side of the screen here. So you can see the number of total results in different areas. So under health topics, for my screen, it says 48. For external health links, there's over 1,000. Under videos and tutorials, there's 3. And under news, there's 22. All right. And then on the right-hand side of the page, you should see the National Library of Medicine health topic page, and that provides you a brief summary. And if you click on the read more, you'll be taken directly to the health topic page for that term. For the term again, I apologize. For the term asthma, you actually have the option of going to a health topic page of asthma or asthma in children. And I would like you guys to find asthma in children. And I can't see what you're doing. I'm just hoping that you're actually looking for asthma in children. So under asthma in children, again, you're going to see some basics on the top. It's going to break it down for you what's on the page. It gives you a brief summary, what causes asthma, including On the right-hand side, you can actually get updates from this page. So if anything is added or deleted or included or changed on this page, if you put your email address here, it will actually send you an email updating you on that. So under a little further down the page, under Start Here, they actually will show you, you're going to see, this is actually from the NIH. So this little symbol here next to any topic, it's telling you that this information is actually coming directly from the NIH, the National Institutes of Health. And they're also telling you that this is also available in Spanish as well. If you're attempting to provide parents with information on how to manage asthma, you may choose to look at the disease management section, or perhaps you need to teach a student how to properly use their dose inhaler. You could refer to the pictures and photograph section, and then you would actually be taken to a list of resources which include a slideshow to show students, or you could print those pages out. And again, you can also receive email updates from here as well. And if you look here on the right-hand side, you'll see other related health topics: air pollution, allergies, again, straight asthma. This is telling you what the organization is. And then under here, you can actually see the different languages available to you where this information can be translated into. So a little further down on the page, you'll find information on the diagnosis and symptoms, treatment, and other options that were available in the menu options. You'll also see a link to any articles on the chosen health topic from within the NIH MedlinePlus magazine, which we're going to look at a little bit later, and the MedlinePlus disclaimer and link to quality guidelines. So here's our very first exercise. You ready? Okay, so you've got a third grade teacher informs you that there's a student who has been itching their head for several days. After an inspection, you find that the student has head lice. The parent comes to pick up the child and requests information on how to treat head lice. So take a moment. I want you to locate information that you can share with the child's parent and the third grade families, and then also tell me what agencies have that information and what type of information they provide. And for those of you, you can just pop it into the chat if you want to just grab the link where you find it and pop it in the chat, and I'll click on it and see if you did it okay. A little hard to build into a webinar, but I think we can do it. Okay, so now that we've dealt with our head lice and we're all scratching, we're going to take a look at the second major section of MedlinePlus, which is the drugs and supplements section. So the drugs, herbs, and supplement section provides you with access to information on prescription drugs, over-the-counter medications, as well as, the ability to browse for information on dietary supplements and herbal remedies. You can learn about side effects, different dosage, and special precautions of drugs, and the effectiveness, usual dosage, and drug interactions of herbs and supplements. So we're going to take a look at the drug section first. For this section, you'll need to browse by generic or brand name, and you can do so by clicking on the appropriate letter or number for the drug you're interested in learning about. So within this section, you can search for drugs using the alphabetic or numeric bar right here. So in this example, we're going to use Tylenol, T for Tylenol. If you click on T, you'll be taken down an alphabetical list of all the drug entries that start with T. And if you scroll down until you get to Tylenol, you'll see that there are several listings for the various Tylenol drugs. We're going to look at the first entry for Tylenol, acetaminophen. This will take you to the MedlinePlus drug information page for acetaminophen and provide access to a variety of information based on the questions listed at the top of the page. You may also note that there is an important warning in the red box regarding the use of acetaminophen. And it is going to list information about that drug. And below the warning, you'll find information on why the medication is prescribed, how should the medicine be used, and what to do if you forget a dose, information on side effects, how to store and dispose of the medication, and what to do in case of emergency overdose. And you can take a look also now at the herbs and supplements section. You can click on all the herbs and supplements, and you'll be taken back to herbs and supplement listing. All right, so if you click on the MedlinePlus in the top left-hand corner, it takes you right back to that home page, and then you can click on the drugs, herbs and supplements, and then under herbs and supplements. So I'm going to do that right now just to make sure that all herbs and supplements. And I'm going to say this wrong, so I apologize. If anybody wants to hop on and say it correctly, I'm all for it. I always say it wrong. They want you to find acai, A-C-A-I, or is it acai? It's A-C-A-I.
It's
and so you can either click on the A or
it's a soft C. It's acai, I think, something like something like that.
Acai. Okay. I'm so glad I'm a health sciences librarian. I never get that right. But you'll also find stuff like garlic and ginger, soy, St. John's wort, tea tree oil, and a listing of different vitamins like vitamin A, vitamin C. So if you want to try the acai, I'm going to say it wrong. You should find the very first entry. So if you do either a search up at the top, and I'm not going to tell you guys how to search because it's entirely up to you and your own preferences. You can click on the A, you can go up to the search box and type in the letters, or you can click on all herbs and supplements and try to find it. Actually, if you do click on it, it's the very first one because in the alphabet it's pretty short. And what you'll notice is that it's also from the NIH, the information is from the NIH. So there it is. So if you clicked on A, it's the very first one. Okay, and you'll see like a brief introduction. So they actually have a PDF version here on the right-hand side that you can download to be able to disperse if anybody has any questions about that particular topic. It'll take you back to health topics. Now, what I'm noticing, and correct me if I'm wrong if you guys don't have it, when I go to the page right now, it says print this page. It doesn't offer a PDF version. So keep that in mind. Things do change really quickly. So when you're searching for drugs, herbs, and supplements, you'll also see this little logo here. It says for FDA approved labels included in drug packaging. So you can actually see the labels that are included in the different packages. If somebody lost theirs or they're not sure how to, where to find one, or if they just really want to see what should be included in the package, you can actually see that under the Daily Med link. Okay, and if we go back to the home page, you'll see the third main section, and that is the videos and tools. All right, and this is the section at MedlinePlus that offers a variety of interactive tools such as tutorials, health and surgical videos, games, and quizzes. I've actually found these to be pretty helpful, especially for our students. They're very visual learners. So this can be, this has a lot of information that can be used to educate parents, youth, health professionals, as well as educators. The health video section has some animated videos that show the anatomy of body parts, as well as organ systems and how diseases and conditions can affect them. There are basic things like blinking, seeing, sweating, and tasting, but then it also has more advanced topics such as concussion, coughing, feeling pain, and vaccines, and these are some of the ones that I demonstrate to my students here. Most of the videos are from Adam Inc., ADAM, and they're usually short animated videos that include closed captioning, as well as a brief overview. The videos also provides a link to pre-recorded webcasts of surgical procedures. There are actual operations performed at medical centers in the United States. You do need Flash Player, little technical click there, to view the surgical videos. So examples of some of the surgical videos that may be relevant include a tonsillectomy, GERD, and a young athlete's ACL replacement. So if you look in the Health Check Tools section, you'll find an alphabetical listing of calculators, quizzes, and questionnaires, as well as, under the Health Check Tools, there'll be a listing of calculators, quizzes, and questionnaires on topics such as calculating your ideal weight and body mass, 10 ways to recognize hearing loss. There's a pet allergy quiz, and as well as how many fruits and vegetables do you need quiz, and some more from reputable agencies such as the Department of Agriculture, the CDC, and a variety of other National Institute of Health agencies. And they all tell you which ones they're coming from. The last section is the games section. And in here you'll find ways that you can encourage students and parents to increase their health knowledge by playing a variety of interactive health games. There's the American Lung Association has a game called Lungtropolis, where kids with asthma can learn to play. Lungtropolis is an interactive web-based game for children ages 5 to 10, and the parents can provide information and resources to caregivers of children with asthma. And by playing the game, the children learn about asthma and how to manage it. Okay, so here's scenario 2. And again, just grab the link and paste it into the chat box. So the principal has informed you that there will be a health fair at the school, and one of the health issues that they want to provide more information on is asthma. It's a very popular topic. Since you are aware of the growing number of students who have asthma, you want to find a fun way to teach children about what asthma is. So try to find a game or activity that you could use to teach children about asthma, and then also make sure what agency created the game and where did you locate it. So again, just provide me the link. So back on the home page, in that left-hand column again, you'll see the medical encyclopedia. Which again will have some short yet detailed images and information on specific diseases, symptoms, treatments, and even laboratory tests. You will see the consistency within MedlinePlus as the medical encyclopedia uses the same alphanumeric toolbar as the other sections. And you can search for terms within the encyclopedia articles. So you can just do a generic search again, or you can actually go through by the top A to Z topics. You're going to find information for over 4,000 articles about disease, tests, symptoms, injuries, and surgeries. And it also includes the medical images from Adam as well. So if you're just looking for something short and sweet. So under the medical encyclopedia, if you click S, and you'll see a section on safe driving for teens. And if you click on that link, you're going to see a variety of information available on the topic. There's a brief summary as well as information on considerations, some causes, home care, and when to contact a medical professional. Images are also available and can be helpful when preparing information to distribute to students and parents. If you choose to use pictures, images from the site, be sure to attribute them to Adam within MedlinePlus. So always cite. Okay, now for this one, again, because they changed the page on me, they didn't include on the home page the new section on lab test information. If you click on that, it will actually give you a list, again, with the same A to Z list, or you can search in the search bar, just make sure you put lab test, and it gives you an A to Z list of the different the variety of types of tests that your physician might give you. And then you can click on one. So albumin blood test, it tells you what it is, what it's used for, why do you need it, what happens during the test, what do you need to do to prepare for the tests, are there any risk to the test, and what do the results mean? And then there's actually a section on showing the references. All right, so again, back on the home page, we're doing a lot of clicking back and forth. At the very bottom, you'll see this section here, the easy to read materials. You can see a listing of the organizations and directories that are used to compile the information, the health information in multiple languages, and then also there's a section on MedlinePlus connecting to EHRs. So if we click on the easy to read materials, okay, again, there's your lovely alphabet list right across the top. You'll see that in just about every one of these sections. But there's also a variety of information on this as well. Because MedlinePlus is a consumer health information website, the articles are written for the public, not for health professionals. Okay, but not all materials on MedlinePlus are the same reading level. So if that's a concern that you're offering, a variety of tools for parents versus children, MedlinePlus does not decide the literacy level of the materials. The people who write the materials are the ones who decide if they are easy to read or not. In general, easy to read materials are usually written at 5th to 8th grade levels. The summaries on the health topics aim for a 5th to 8th grade reading level. When you want to locate them, you're going to click on this section, and then you've got a list of easy to read documents that can be found in a variety of health topics. And when you're out and about searching in other Medline sections, there's actually an easy to read graphic that you will see next to anything like that. There's also a section on how to write easy to read health materials. A lot of medical concepts and languages are very complex, and people need easily understandable health information regardless of age, background, or reading level. So you'll find guidelines to help you create your own easy to read health materials. And you yourself can determine the level of the audience's reading capabilities. Okay, so you'll see that lovely easy to read section right there. So this is an example on what is acne. And this is from the National Institute of Arthritis and Musculoskeletal and Skin Diseases. Again, if we go back to the home page, and on that second section there under organizations and directories, again, you'll see that lovely A to Z list. And these are the listings of organizations that provide all the various health information. It defaults to an alphabetical listing. However, you can choose to arrange the list by topic. And that can be helpful when you want to refer parents or even school administrators to support groups, or if you're looking for potential speakers for the school. In the directory section, you're provided with links to directories to help you find libraries, health professionals, services, and facilities. It's important to note that the National Library of Medicine does not endorse or recommend any of these organizations. However, it can be a useful tool if you find parents need a referral or you're looking for a specialist. Again, going back to the home page, that lower column, or that lower row again, we've got health information for multiple languages. So if you click on that, again, you've got an alphabetical listing there, but you'll also see that you can actually link to HealthReach as well for additional multilingual health information. So if you're not finding it here, which I would find rare, you can actually reach out to HealthReach as well. And so on the next page, we've actually got an example. So this is nebulizer treatments, and on the left is in English, and on the right is in Japanese. And when you go to HealthReach, so a lot of the hospitals, clinics, and community health centers and voluntary organizations operating in the United States provide a broad range of health services to individuals with limited English proficiency. Discussing health conditions and available services can be a challenge without timely access to reliable, culturally and linguistically appropriate information. And yes, I had to read that quote because my tongue's not working. HealthReach is a national collaborative partnership that has created a resource of quality, multilingual, multicultural public health information for those working with or providing care to individuals with limited English proficiency. So some of the resources you're going to see are health education materials in various languages and formats, the different brochures, fact sheets, and videos as well. There's some provider tools, including best practices, cultural information, and effective use of interpreters. And then there's a special collection on emergency, disaster, women's health, and mental health. And you can, again, search HealthReach by topic, selecting a language, or search by format. So our next scenario, number 3. It is the beginning of the school year and you are checking student immunization records. You notice that there are several families that recently arrived from Iran and Afghanistan. The principal informs you that some of the families have limited English proficiency. Locate information on immunization in Farsi for these families. So let's see what you guys can find. Just pop your link in the chat box. So we want immunization in Farsi. We want immunization information in Farsi. That's Farsi. So the final section at that bottom, let's go back to the home page, our favorite place. Okay. And this is MedlinePlus for Connect to Electronic Health Records. If any of your schools are currently using or looking into the use of EHR, EMR, electronic health records, electronic medical records, then this might be something of interest to you guys. There are several organizations that believe that EHRs are essential for school nurses to provide efficient and effective care in the school and to monitor the health of the entire school population. And if you're in a district that does offer this type of service or is investigating it, I would encourage you to speak with your school administration about the implementation of MedlinePlus Connect. So it basically is giving information on how to connect your patient portals for the nurses to be able to access them, the school nurses to be able to access them. And if you go back again to our homepage, again, our favorite place in the whole world, again, my page is going to be a little bit different because they have changed this. They've put their Twitter feed front and center. They used to have something called Today's Health News that was right there. Not really seeing that on the new one, but what it basically was is just like the whatever's coming out in news from the day, and you can, if you clicked on the link, it would go more. I'm not really seeing anything on the page that would take you there at this point. If anybody finds anything, please feel free to pop the link into the chat box. And what you should see is, again, here's the latest health news. This is from January. I did, update this fairly recently, and it will help you to, it'll take you to links on evaluating all that health information as well. This is a kind of a bone with me, being a health sciences librarian, but also being a librarian for many years, making sure that our users are understanding what they're using for. And so recognizing, considering the source and focusing on the quality and knowing where their information is coming from. Google is a great tool. All the, the browsers are great tools, but if you don't know where the information is coming from, so making sure that your users are aware of where their information is coming from. This particular page I think is helpful because it gives all your students ideas and all your users ideas on what types of things they should be looking at to determine whether or not a website they are reviewing is being used and is useful and is coming from a reliable source. And they actually have a section here for librarians and trainers as well. You'll find a brief tour in English and Spanish, as well as some brochures in English, Spanish, and Creole. And you'll be able to find information on how to find and evaluate online information. There's some tutorials. And again, you're encouraged to contact your RML or your regional medical library, as they can direct you to other training materials that they have to offer. MedlinePlus always includes a variety of health topics that may be of interest to you as a K through 12 health professional. There are a broad range of topics available, including bullying to use with your anti-bullying school campaigns, ergonomics, which can provide useful information for you to share with colleagues, as well. And some additional topics would be internet safety, nutrition, parenting, sports injuries, and even weather-related topics. All right, so we're going to move on to the next section, which is on drug information resources. Now, this is PubMed. So this is my baby. This is the one I use pretty much daily. PubMed is a service of the U.S. National Library of Medicine, and it provides free access to Medline, the NLM database of index citations and abstracts to medical, nursing, dental, veterinary, healthcare, and preclinical science journal articles. It can be used to locate research information about a disease or a condition, as well as teaching students how to begin to conduct health research, as it includes some tutorials and access to full-text articles via PubMed Central. So there is a lovely section. And just to mention here, they point out the tutorials. They've actually kind of streamlined their tutorials. For those of you who haven't checked them out yet, they've kind of condensed them down into anywhere from 2 to 3 to 5 minutes. You're not really necessarily watching an hour-long video on how to use PubMed or how to use a particular section of PubMed. The other section they want to talk about here today is PubMed Central. Right here under Popular, in the middle at the bottom, there is a link to PubMed Central. So this is the U.S. National Institute of Health Digital Archive of Biomedical and Life Sciences Journal Literature. Participation by publishers in PubMed Central is voluntary, although participating journals must meet certain scientific and technical standards. PMC, as we like to call it, is not a publisher, and access to the material in PMC is free, but use of material is still subject to copyright and/or related license terms of the respective authors or publishers, and you can see the PMC copyright notice for more information. This is where you can have students look for articles so that they have full access. You could even locate a few research articles on a topic of your choice and then have an example for them to practice searching in PubMed and learn to dissect the parts of a published research article. So as you can see, how many we've got over 4 million, and I know it's changed since then. You've got over 4 million articles are archived in PubMed Central, and you've got over 1,900 full participation journals. There are 316 NIH portfolio journals and over 3,900 selective deposit journals. So PubMed Health, this is another section of PubMed, provides information on prevention and treatment of diseases and conditions. PubMed Health is a great tool to introduce students to clinical effectiveness research, as it includes easy-to-read summaries and focuses on the what works in medical and healthcare. PubMed Health provides a nice way to introduce students to health news and how to interpret it. Although not updated daily as such as like MedlinePlus or as frequently as its research counterpart PubMed, this is a great place to locate health news articles as examples when considering teaching students about health news or evaluating health information resources. It's a good example of hot topics such as death risk and sleeping pills, nicotine patches, and mental decline, obesity, and vitamin D levels. So this is AIDS info. Right now, there are 33 states, as well as the District of Columbia, that require students to receive instruction about HIV/AIDS. The AIDS info infographics make the concepts easy to understand. AIDS info is a service of the U.S. Department of Health and Human Services, and it offers access to the latest federally approved HIV/AIDS medical practice guidelines, HIV treatment and prevention, clinical trials, and other research information as well. They have stuff like fact sheets, a medical dictionary of HIV-related terms, images of HIV-related topics using infographics, and web pages highlighting their HIV National Awareness Days. So the National Library of Medicine produces a variety of information databases on, as we just reviewed, on drugs and herbal supplements. So some of the other stuff you're going to find, as I just mentioned, on the NLM webpage, you can find, these are basically they're flyers that review ToxNet, MedlinePlus, and then the drug information at the National Library of Medicine. So again, this is a lot of information, and you're gonna pick and choose. You're gonna cherry pick what's valuable to you. This is actually one of my favorite ones. It's called Pillbox, and it was developed to aid in the identification of unknown solid dosage pharmaceuticals. That's verbatim. So basically, you can search by color, by a shape. If you find letters or numbers on the pill, you can include those as well. And then you would click search, and it would I'd try to identify the pill for you. It combines high-resolution images of tablets and capsules with all the appearance information, and so you can actually identify the forms based on physical criteria, as I mentioned before, any imprinted numbers, the shape, the color, any scoring, because some of them are solid, some of them have scoring, others are not. And the images are continually updated as the user enters additional information. It's actually designed for emergency physicians, first responders, or other healthcare providers. But to be honest with you, if you're in the bathroom and somebody dropped a pill and you come across it, you'd like to know what it is, so that nobody gets, somebody accidentally takes it and nobody gets sick. It's kind of a cool little tool. So based on this, and if you just do a lovely search, just go to Pillbox. It is, I've actually got the URL here. So it is pillbox.nlm, and this actually leads into our next scenario. So you're actually going to search for a drug using Pillbox. So I've put the link in there, and here is the pill you're going to identify. So what you're seeing as a physical education teacher, or whatever kind of teacher or librarian you are, or nurse, somebody found this Ziploc bag in the gym with several of these pills. The imprint reads 4H2, and the pills are white. I apologize for the black and white photo. It's not great. So see if you can find a link that gives the name of the drug, the brand, why is the drug prescribed, and what you should do in case of emergency overdose. So basically go to Pillbox, enter in the information that you see that's available to you, and see what you come up with, and then just pop the link in the chat box. So there's also the drug information portal. The portal provides users a comprehensive gateway to information on over 53,000 substances. And these are not only from the NLM, but they're also from other U.S. government agencies. It covers drugs from the time they are entered into clinical trials through their entry into the U.S. marketplace. So this would be really helpful if you want to see where a drug is in the process of approval. It's intended as a middle ground resource, because it includes information for the consumer, health professionals, as well as researchers. I'm so sorry, this cold is just knocking me out. Okay, another resource for drugs is called DailyMed, and it provides information about marketed drugs, including FDA labels. This is also where you can get some of the package inserts. So on MedlinePlus, they had a section for the package inserts. DailyMed does as well. And then it'll provide information for the health information providers, as well as the public, with a nice standard, comprehensive, up-to-date lookup and download resource of the medication content and labeling as found in the medication package inserts. So if you go to DailyMed, it's nice that they give me the URL for these, and it's dailymed.nlm.nih. So these are all through the NIH, and here's our lovely NIH webpage as well. So the database will link you to the information from the labels of over 30,000 dietary supplement products in the marketplace, including vitamins, minerals, herbs, or other botanicals, some amino acids, as well as some specialty supplements. It includes the name, form, active and inactive ingredients, amount of active ingredient, the manufacturer, the distributor information, basically everything you're going to find on the label or the insert. And it can be searched by product name. You can throw in text terms, or specific dietary ingredients, as well as manufacturers. So you've got a lovely little search box up there. Okay, and ToxNet. This is kind of a bane for me. ToxNet was supposed to change their screen a little bit, and they haven't. They've sent us a couple of emails about updates, but they haven't really changed anything just yet. But ToxNet is another database for drugs, but also lactation, or LactMed, which is in a response to the prevalence of breastfeeding worldwide. Okay, so drugs in breast milk pose a potential risk to the breastfed infant, and LactMed provides healthcare practitioners and nursing mothers with data and information on drugs to which breastfeeding mothers may be exposed, and the effects of those agents on nursing infants and on lactation. It has about 1,000 records on drugs, herbs, and dietary supplements, and it includes a summary regarding use of the specified substance during lactation, potential alternative medications, and references that are linked to their respective PubMed records. LactMed is endorsed by the American Academy of Pediatrics. Okay. And liver tox, which I think by the name is pretty straightforward. So it's also another freely available website that provides up-to-date, comprehensive, and unbiased information about drug-induced liver injury caused by prescription and non-prescription drugs, herbals, and dietary supplements. LiverTox represents a collaborative effort by medical and scientific specialists to provide a central repository of clinical information in support of clinical and basic research on the prevention and control of drug-induced liver injury. It will provide, in addition, guidance to clinicians and healthcare providers on the diagnosis and management of this important cause of liver disease. This is a joint effort of the Liver Disease Research Branch of the National Institute of Diabetes and Digestive and Kidney Diseases, or NIDDK, and the Division of Specialized Information Services of the National Library of Medicine and the National Institutes of Health. All right, and I believe this is our last scenario, so you can all breathe easy. All right, it's flu season, and you want to put a note in the school newsletter for caregivers, teachers, to recognize the signs of flu and what the differences are between cold and flu. Using MedlinePlus, locate a handout or resource that you can direct caregivers and teachers to. And while everybody else is frantically looking for other information on whether or not it's a cold or a flu, I'm going to take a moment here and pause. Again, I know this is a lot of information. My best suggestion is pick and choose those items that you think you're going to use the most and that fit your specific needs. I mean, MedlinePlus is pretty much an all-in-one, but if you have a reason for using the others, then I would say, bookmark them and hang on to them. Any questions so far? It is, and that's the helpful part of this, is that it is reliable, and for me, that's the most important part. Again, Google and Yahoo and Internet Explorer, yes, I'm old, are great search tools, and we as professionals know how to search them and look for the stuff. But when you're providing resources to students or teachers who maybe don't know where to look, having this is kind of like in a toolbox somewhere to say, hey, here's where you want to find that information, or here's where you can find reliable information. All right, so the next section here is kind of and I'll go through it because I know everybody wants to get home and get out of the snow. But I'll just go through it quickly. It's primarily a collection of resources from the NLM, the National Library of Medicine, and some of its subsidiaries and other groups. So the next section here, and I've actually used this, the NLM exhibition program. Unfortunately, none of them are available at this point. I've looked and they've changed, but I've actually used a couple of these. There was a Harry Potter one that we used in addition with a speaker. We actually had somebody talk about Harry Potter and medicine. I've done, oh shoot, I'm not going to think about it. George Washington, there was one on George Washington as well. So there's really a lot of really great resources. They say that they're free, and they are. However, you do have to pay to ship them to the next library. So that's the caveat there. But it's a great resource. So this is one of theirs. They're pictures of nursing. And then there's also a gallery of National Library of Medicine mobile applications and sites. For the most part, these are free. There are a few PubMed apps that might cost you 99 cents, but they're also helpful. My husband actually uses one pretty regularly. MedlinePlus actually has a magazine that comes out, so you can actually order it in bulk, or you can order individual subscriptions if you want to leave them out for faculty and students to check out. The idea of the magazine is to present you with the best and reliable, up-to-date health information. We actually get copies here for our students and leave them out, and they do get used. They do get read. We actually catch them reading them. So I do encourage you to order them. The NIH News and Health. This is another way to introduce your older elementary, middle, and high school students to new health. It's a newsletter that's published monthly, and the website allows you to view past issues and download PDF versions of each newsletter. You can have students focus on just one topic or choose several and have them work in small groups. So this is great for different lesson plans. And the newsletter provides a way to obtain short articles that rather than big lengthy PubMed articles that might be too much for middle school. And it gives them an awareness of different diseases and conditions. The Health Careers Comic Book Project. And actually for the traveling exhibits, the NLM actually has a a graphic medicine exhibit that they're promoting recently. So this is the South Carolina AHEC partnered with the U.S. National Library of Medicine and then 3 low-country high schools for a health information literacy project. The students were charged with researching public health themes and creating educational comic books geared towards middle school students. And in the process, the high school students learned about helpful resources from the National Library of Medicine, gained valuable communication, research, and creative skills, as well as increasing their knowledge about health careers and improve their health literacy, because one of the best ways to learn something is to teach it. So you can actually go to their website and check out some of their pages as well. And then under their digital collections, this is a free resource of biomedical books and videos. All of the content in digital collection is freely available worldwide and unless otherwise indicated in the public domain, which usually means you can use it pretty well easily. And it provides some pretty unique access to some of their resources. The outreach activities and resources. This is a reliable health information by K-12 professionals. It's done through training on numerous resources developed by the NLM, and they're designed to engage students' interest and foster their analysis of a variety of health and science-related topics. They use instructional templates, lesson plans, resources, and more. So you can actually show this to your teachers, and they can use this to create lesson plans on health. Finding and using health statistics. This is probably something that we would use more often. A lot of the health statistics they're hard to understand and difficult to locate. So this is an actual online course, and I've actually signed up for it myself. The first part focuses on learning about health statistics, and then the second part focuses on how to find health statistics. Primarily for me, this is research-based. We plan on participating in our research day, so we're looking for statistics, reliable ones that we can use to make our point. And then the CDC does our Healthy School, which is a virtual healthy school. It's an interactive tool that shows how components of the whole school, the whole community, and then the whole child model can be integrated into your school. It calls for schools, families, and communities to work together. It expands on the Coordinated School Health Initiative to provide a collaborative approach to learning and health. It encompasses the whole school, acknowledges that learning, health, and schools are reflections of the community, and the focus of the model is on the whole child. You can use the school layout to see what we've done in 10 areas to meet the needs of the whole child. You can learn how Jefferson School teachers are following recommended guidelines to improve student health in the primary, upper elementary, and middle grades. And you can check out medical equipment and resources available in the nurse's office to treat students' conditions. They actually have a section on the counselor's office, so you can see some tools that counselors use in sessions with students. You can swing by the cafeteria and you'll see healthy, appealing food choices. And then they also have a playground and gymnasium that you can see different ways that you can promote physical activity. Or you can lastly visit the principal's office to find out how the principal maintains all the emergency plans, and then even take a peek into the conference room to observe a school health team meeting. And you can pick on any one of the doors there to choose what section you want to go to. I think that's a fun one. I don't get to use it much. This one I get to use a lot, the evidence-based programs and practices. So this is a full of information on evidence-based programs and practices. I promote this with our faculty as well. It has a section on blueprints for healthy youth development, teen pregnancy prevention, and other resources from reputable agencies. And this is the teach back. And I don't think in the last one I did where is that better? Yeah, sorry, my knee hit it. Sorry, I'm back. So this is the teach back training toolkit. So this will help support patients and families throughout the care continuum, especially during transitions between healthcare settings. What I like about this is it actually combines some of the health literacy principles with plain language, and then they use the teach back to confirm the understanding. And this, for me, I promote this to our students because they're often out on the field and they're dealing with patients who may be non-English speakers or who maybe don't really understand. Even though it's also used a lot with youth caregivers and other 12. The last couple, I think this is the last one. So this is the NNLMs. You can order free educational and print materials. I avail myself of this on a regular basis. You do have to be a member, which is free, and you basically create an account, and then you can actually order different posters. You can order brochures. You can order bookmarks. And different stuff that you can distribute to promote the different health resources. And then And I think that's about it. They do have their training schedule here, their different class descriptions. I've actually signed up for several classes with them. So that is the the NNLM's free educational and print materials. And of course, we always ask that you join. Look up at the training schedule. It's actually pretty helpful. I take at least one a month myself. And you can take a look and see what kind of other meetings they're having. Usually there's at least quarterly, if not annual. And again, membership for the NNLM is free. And for the most part, the trainings are free. And I've, again, found it as a valuable resource. So I hope that you were all able to enjoy this and get something out of it, even if it was just 1 or 2 items. So I don't know if this link is going to work. Oh, it does for me. So Alice, do you want to pop on?
Yes, here I am. Okay, so yeah, we need, since this is funded by the NLM, we have to ask certain questions, and the first question is sort of weird because it's what's your zip code? And use your work zip code because they want to know, demographically who they are reaching. So just click on the survey. There are like 6 questions, and it should take you like less than a minute to do. Thanks.
Okay, Anita was just saying that the main benefit is that they can access them from anywhere, and that is absolutely true. One thing that I will say about the National Library of Medicine with their websites is if there's not an app available, they have made the pages very friendly for all different formats, whether it's a tablet, a computer, or even your phone. Everything's dynamic and will adapt.
So if there's nothing else, we'll say thank you to everyone. I really appreciated you being attending this webinar, and use some of these sites. They're really excellent, and you'll be very happy with them. Okay, bye.